If you think Sjogrens is just dry eyes and dry mouth, that's wrong. It's day 1 of Sjogrens week, and we need to talk about what Sjogrens actually is. Sjogrens isn't just a minor dryness condition. It is a systemic autoimmune disease. That means that your immune system is dysregulated. It's mistakenly attacking your own body. Now, most commonly, that's the glands that produce tears and saliva, but it doesn't always stop there. It can cause skin dryness and genital dryness, and it can affect other organs, including joints, skin, lungs, nerves, and kidneys, and your energy levels in a very real way. Now, the dryness is often the obvious part, but the systemic inflammation is the part people can overlook. If you feel minimized that your symptoms are only dryness, that's an incomplete explanation, and it isn't a reflection of all the other aspects of this disease. Why did we stop calling it Sjogren's syndrome? Because words matter in medicine. It's day 2 of Sjogren's week, and today we're talking about why Sjogren's was renamed as a disease and not a syndrome, and why that is important. Syndrome means a collection of symptoms. Dry eyes, dry mouth, a cluster. But Sjogren's isn't just a symptom cluster. It has a defined autoimmune pathogenesis, it has systemic involvement, it has measurable immune dysregulation. Shifting to Sjogren's disease reflects what it actually is, a systemic autoimmune condition, and language matters. When something is labeled a syndrome, it can sound vague, mild. Calling it a disease reinforces that this is a real, biologically driven autoimmune process that deserves serious evaluation and monitoring. And that is further driving patient care and targeted research. Tomorrow, I'm talking about primary versus secondary and why that label does not mean what people think. If you've been told you only have secondary Sjogren's, let's clear something up. It's day 3 of Sjogren's week. Let's first talk about primary versus secondary Sjogren's because this gets misunderstood all the time. So primary Sjogren's means the disease is occurring on its own. Secondary Sjogren's means it exists alongside another autoimmune condition like rheumatoid arthritis or lupus. That's it. It does not mean milder, less serious, less real, or less deserving of attention. Secondary does not mean of secondary importance. Both forms can have systemic involvement, both can cause fatigue, organ issues, and quality of life disruption. The label simply describes coexistence, not severity. Along with the name change from Sjogren's syndrome to Sjogren's disease, the descriptor associated has been recommended in lieu of secondary. And it can be important to distinguish between primary and associated forms because it could affect our clinical evaluation of affected patients as well as in the clinical decision making. But if anyone made you feel like your disease mattered less because it was secondary, that was an oversimplification. Your labs can be completely normal and you can still have Sjogren's. It's day 4 of Sjogren's week. Sjogren's is often associated with antibodies like SSA and SSB. But here's the reality. Not every patient with Sjogren's has positive antibodies. You can be seronegative, meaning your blood tests are negative, and you can still have real, clinically diagnosable disease. So while of course we check labs, diagnosis is also based on symptoms, objective dryness testing, and sometimes a lip biopsy, as well as the overall clinical picture. Labs are tools. So when someone says your labs are normal, don't feel like that is the end of the story. It just means that we may need to dive deeper, including looking for other, perhaps non-rheumatologic causes of your dryness symptoms. This isn't just in your head. You are not being dramatic, and negative blood work does not invalidate your symptoms. Tomorrow, I'm talking about fatigue and brain fog, the symptoms that probably disrupt life the most in Sjogren's. If you have Sjogren's and the fatigue is what's ruining your life, then you're not alone. It's day 5 of Sjogren's week, and we are talking about one of the most disruptive symptoms of Sjogren's, and it isn't dryness. It's fatigue and brain fog. This isn't just being tired. This isn't poor sleep hygiene. This isn't laziness. Autoimmune fatigue is driven by inflammatory signaling. Elevated inflammatory cytokines or signaling molecules that are affecting your brain, your muscles, and your nervous system. It can feel like movement being heavy, difficulty finding words, needing recovery time after basic tasks. And because it's not measurable or quantifiable, patients often feel dismissed. But biologically, it's very real. If fatigue is your worst symptom, that doesn't make you dramatic. It means your immune system is active in ways we don't fully measure on routine labs. And that is a challenge both for the people who are dealing with it, but also for the physicians trying to treat it. Tomorrow, I'm talking about what good Sjogren's care looks like. Not all Sjogren's care is comprehensive, and it should be. It's day 6 of Sjogren's week. Let's talk about what good Sjogren's care should actually look like. So the basis of Sjogren's care does involve managing the dry eyes and dry mouth and preventing the complications that result from the dryness. But comprehensive care means evaluating for systemic involvement, monitoring for lung, nerve, or kidney complications, assessing fatigue and quality of life, watching out for lymphoma risk, and then a whole spectrum of individualized treatment based on symptoms because of the systemic nature of the disease. Treatments could range from lubricating eye drops and saliva substitutes to medicines like hydroxychloroquine to manage the mild inflammation, and all the way to stronger immune suppressants for joint and organ involvement. So it may be worth asking your rheumatologist what's included in your big picture. Tomorrow is the final day of Sjogren's week. I'm talking treatment myths and setting realistic expectations. There's no cure for Sjogren's, but that doesn't mean there isn't a strategy. It's day 7 of Sjogren's week, and let's talk about the management strategy and set some realistic expectations. The biggest myth is that it is just dry eyes and dry mouth, and there is nothing we can do, when in fact, we do have symptom-targeted therapies, immune-modulating medications when appropriate, and the goal here is to protect the organs, reduce inflammation, and preserve quality of life. Another myth, if one medication doesn't fix everything, it isn't working. But actually, Sjogren's management is layered. The medicines and strategies used to treat the systemic symptoms, such as arthritis, won't work for the dryness symptoms, and vice versa. Also, any good strategy should involve self-advocacy and taking a holistic approach and self-care to improve your overall quality of life. Stay tuned, because in the future, there are some potential disease-modifying therapies that are showing promise in clinical trials. Drop me a comment with questions or any topics I didn't cover this week that you would like to learn more about.